In general, on the streets of LA, some things have changed, but in general, for the singular person on the street, most has stayed the same. They're still suffering from the same material poverty for want of a home or want of food. And we know that about a third of people are eating 4 or less meals a week. Still the same physical comorbidities, physical illness, substance use disorders, psychiatric disorders, and still the same spiritual poverty of feeling unwanted or unloved. And these things, we have to address all of them if we really want to talk about caring for people and solving homelessness.
You're mentioning 1 out of 3 don't have 4 meals. They have 4 meals a week, because we know a lot of nonprofits that are actually handing out food. What's happening?
Yeah, so the vast majority of services, especially food services and shelters, are concentrated on Skid Row. But when we talk about unsheltered homelessness, so people not in the shelters, not in transitional housing, it's about 5% in the county are on Skid Row, but still the vast majority of resources. So outside of Skid Row, it's really, really hard to get access to your basic needs, including food. And so even if you have a soup kitchen or a food pantry, the sprawl is so big that it's really hard for people to get there. It's not nearly enough. So most of them rely on actually buying their own food, is the most common way that they get it, according to our research. And about a third are getting 4 or less meals a week. And this has consequences for everything, right? So they have to make these difficult decisions, the opportunity cost, economics 101, that if they choose to, so they have to buy their food, and if they're going to buy it, they have to find money somehow. So maybe they're going to panhandle for that. And if they choose to not do that day, because they have to go to the DMV for an ID, go to the doctor for a doctor's appointment, go for a job interview, they have to make this difficult decision. Well, now I won't eat today in order to go do those things. And that's a decision that you and I don't have to make every day.
And in terms of you being on the streets, you guys go to them because they cannot go to the hospitals. We are hearing that people go to the emergency rooms. Which one is true? Are both true?
It's both. We call it a diurnal pattern. So there's a majority actually who don't access healthcare at all. And there's a number of reasons why that is. And then another part that are what we would call super utilizer. They access a lot of healthcare, mostly in like emergency room, hospital type of settings. And the idea is that you don't want to wait until it gets to this point that they have to use the emergency department and the hospitals. We want it to get, as they say, the right care at the right time at the right place. And that's part of what street medicine is coming up a way to deliver healthcare in a way that's accessible to them, acceptable to them, and can flip the power dynamic in their favor where they feel most comfortable.
You mentioned there's the spiritual poverty, there's the food side, there's the material. What about the drug side? Because we are seeing a lot of drugs, and is that a component of people becoming homeless?
Yeah, absolutely. The drug side straddles the health poverty and the spiritual poverty. It's hard to say. Some people came to homelessness because they started using drugs. I actually think this is a small amount. Most people started using once they got onto the street, because it's horrible on the street. And anything that you can do to just dull that pain for a minute, in an act of desperation, you want to do that. There's also a safety component, especially for females on the street, where over 90% are sexually assaulted at some point during their time on the street. And so it's very common for them to start using methamphetamine in order to stay awake at night so that they can just walk in a self-protective way and then sleep during the day. So for your viewers, if you see somebody sleeping during the day experiencing homelessness, this is not necessarily because they're lazy, they don't feel like doing anything. They were probably awake all night just trying to protect themselves. And so it's very difficult to make the clear connection that when you use drugs, you wind up homeless. It's much more complicated than that.
Was there a moment you realized that there is a spiritual poverty in the streets?
Some of the questions I would ask myself about that kind of led to the focus on the spiritual poverty was like, on one hand, the rest of the community, like the rest of the medical community was saying not to do this, not to go out onto the street, not to get too close, and that I should practice self-care. And most of the self-care was about retreating away from the problem.
So not get too engaged with the patient?
Yeah, don't get too engaged with the patient. You should be disconnected so that you don't bring it home with you. And that didn't seem to work. It didn't seem to work for me, and it didn't seem to work for the patients. And then I realized that like this can't be just like a job that I go to and leave on the street. This is real. There's real suffering on the street, and that part of what the folks need is for us to share in that with them. That it can't just be giving out of our excess. Like most of our programs are something out of excess. It's some grant, some philanthropy, and we do a little bit, but it's not a firm commitment to the work. And so the people have been so excluded, so expelled that they need to know that there's a firm commitment from you too. It can't be done by half. And so the more I would engage in them, the more of myself I gave. We talk about them building trust, but do I trust them? You know, I want to know all these things about them, all these things about their history and their trauma and who did what to them in their past, but do they know anything about me? If this is a relationship, it should go two ways. And so I would share a little bit about me, and they would share a little bit more about them. And then I realized that we would get to this place of solidarity where, you know, in the medical community, typically we're very like parental. We tell people, you should do this, you should do that. And then we sort of flipped that in street medicine and said, well, it should be patient-led. Like we should follow what they want us to do. And that's better than us telling them what to do. But the real goal is this solidarity point where I don't really know who's leading. We're working so closely as a team that we're doing this together. So for example, very simple, if I'm treating somebody's blood pressure and they're taking their medication, is this my goal or their goal? Well, of course, like I want them to take it because that's why I do medicine. I want people to be healthy. And if they want to take it, they want to be healthy, that's their goal. It's the same goal. That's exactly where we want to get to. Where it gets confusing to people is when you have the same organization that's sending them mixed messages. So for example, and I think this is for some of our governments too, is if you have the same government that they don't know the difference, like most of us don't know what's city, what's county, what's state. It's just like the government, you know. The same government that's on one hand pushing them, you know, sweeping them from place to place, and then also sending out a team to help them. You know, not like first we sweep you and then now we'll send out Department of Health or Department of Public Health and help you. This is confusing. Which government should we trust? And it tends to be the one that most impacts their life. And so you have to just have an overwhelming amount of help in order to counter the impact of getting pushed around everywhere. So that consistency is part of it. You can't solve a spiritual poverty without that. You know, the other thing I noticed about it is like when you're in this state of oppression, which they are because they can't go places that other people can go to, like they can't sit on a bench for too long, they can't go into a restaurant for too long, and then you start to believe these things about yourself, that you really are less than human and you really don't deserve these things. And then you begin to treat other people that are like you the same way. And so that's why you see so much, maybe they'll steal from each other, maybe they'll treat each other poorly, because that's also what they have been taught about themselves. And so the first thing to do is we don't give them their humanity that's inherent in them, being human, is to just help them recognize that with acts of love. And that's how you solve the spiritual poverty.